Okay, we're going to go ahead and let a couple more people trickle in. We're going to go ahead and start in a few short minutes. Okay, we're going to go ahead and start. First and foremost, we'd like to thank everyone for joining us on the call. And I just want to go ahead and give a quick intro to the webinar. So this is a part of the Safe Spaces webinar series where we discuss different aspects of healthcare. So today is going to be a conversation with Black women on COVID-19 health disparities and vaccine hesitancy. So a little bit about AMHP. American Muslim Health Professionals is a national nonprofit organization focused on fostering collaboration between Muslim professionals from different sectors of healthcare who seek to advance public health, social justice, and civic engagement within their communities. AMHP's core areas of focus are mental health, advocacy for underserved communities, and professional development. The mission is to bring together and strengthen the impact of Muslim health professionals to improve the health and wellness of all Americans. Joining us on the webinar today as panelists is going to be Dr. Daria Terrell. She currently serves as the Medical Director of Clinical Programming and Health Outcomes at St. Bernard Hospital. A graduate of Brown University and Case Western Reserve University School of Medicine, she completed a residency in orthopedic surgery at the University of Pittsburgh and a fellowship in orthopedic oncology. She worked for several years as an orthopedic oncologist in DC before returning to Chicago. Dr. Terrell has been practicing general orthopedic surgery at St. Bernard Hospital since 2011, where she also serves as the chairman of the Department of Surgery. Zainab is a recent graduate from Johns Hopkins University, where she obtained her bachelor's in public health with a minor in Islamic studies. Currently, she is working to help increase access to primary and preventative care to underserved individuals and communities in Houston, Texas, as a health advocate. With the help of Johns Hopkins University Islamic Studies program, she is also serving as a vaccine ambassador for AMHP to help address vaccine hesitancy in underrepresented populations. I would like to go ahead and now turn the mic over to Zainab Jimoh.
Thank you so much for that amazing introduction, Yamin. I'm really excited to be a part of this webinar. I think the topic of discussion today is something that is very necessary and important. I'm very honored to be able to help create a safe space for Black women to have their voices about their lived experiences amplified. For centuries, not just Black women, but Black people in general have had their autonomy over the decisions they are allowed to make about their health stripped away from them due to deeply rooted systemic racism that was literally built into the foundation of this country. A term that describes this is medical apartheid. So medical apartheid, it describes the extensive and complex history of medical racism in America that Black individuals have endured for centuries. It is the racial discrimination, bias, and prejudice experienced by Black individuals in the medical world that oftentimes cause them to have significantly less positive health outcomes. Experiences of medical racism in the US dates as far back as the 1800s. A historical example of medical apartheid is demonstrated with the history of James Marion Sims. Sims was a surgeon whose contributions to the medical world influenced some individuals to regard him as the father of modern surgical gynecology. However, many of his contributions and recognitions came at the vital expense of Black women. For example, in the 1840s, he developed the first surgical technique to repair obstetric vesical vaginal fistulas, which is a complication that occurs during labor when a hole forms in the vaginal wall. However, this surgical development was only possible through the exploitation of enslaved African-American women whose bodies he operated on without their consent or the use of anesthesia. His reasoning for not using anesthesia while performing non-consensual open surgery on these women's bodies was the racist notion that Black women feel less pain than white women, a notion that unfortunately some health professionals still currently believe. To this day, Sims' cruel experimentation benefits our medical system, while the women whose bodies were exploited are often never mentioned. The names of the Black women that we know of who helped contribute to surgical gynecology are Betsy, Anarcha, and Lucy. Another historical example of medical apartheid includes the story of Henrietta Lacks. Henrietta Lacks was a young Black mother with cervical cancer who went to the Johns Hopkins Hospital for treatment. And while receiving radiation treatment, a doctor by the name of George Gay had took a sample of her cancer cells without her knowledge or consent and gave her cells the name HeLa. Her cancer cells were the first human cells to successfully survive and multiply in a culture. Her cells marked a huge breakthrough in the medical world as they were used to help develop the polio vaccine, study the AIDS virus, and complete research on cancer. Unfortunately, Henrietta Lacks later died from her cancer due to its severe aggression. Yet, even after her passing, Gay had continued to retrieve samples of her cells. For over 20 years, her family was completely unaware that her cells were being stolen and being used to create an entirely new sector of medicine. Drug companies, researchers, health professionals, and millions of patients profit and benefit off of HeLa cells. Yet many people are still unaware that this benefit comes at the expense of the exploitation of another Black woman and her body. I wish I could say that medical apartheid and medical racism have been left in history, but as we all know, that is simply just not the case. There are many modern day examples of medical apartheid that are often demonstrated as statistics within research. Research shows that there is a higher maternal mortality rate among Black women in comparison to other races. Additionally, it shows that Black women are 40% more likely to die of breast cancer compared to white women, which is often due to Black women receiving a later diagnosis. And furthermore, research demonstrates that, as mentioned earlier on, health professionals, some of them still hold the racist belief that Black people have a higher pain tolerance than white people, which results in less pain medication being administered to Black patients. However, one of the most relevant examples of medical apartheid today is taking place with COVID-19. So as shown on this graph, data shows that Black individuals are more likely to contract and to die from COVID-19 because of a lack of representation in the healthcare system, underlying health conditions, high employment on the front lines as essential workers, a lack of access to necessary resources, and of course, systemic racism. If you were to disaggregate the data shown on this graph even further, we would see that in terms of COVID and women, Black pregnant women experience higher rates of hospitalization and severe illness due to contracting COVID-19 compared to other races. Yet, despite these striking disproportions, Black individuals are still less likely to receive a COVID-19 vaccination in comparison to other populations. Looking at the data shown on this slide, data taken from the CDC, we see that the Black population has the lowest percentage of individuals who have either received at least one dose of a COVID-19 vaccine or are fully vaccinated. And this data is pretty recent, going from December 14th, 2020 up until yesterday, September 29th, 2021. This large disproportion in vaccination rates can once again be due to a lack of access, a lack of care, a lack of information, and a lack of trust within the American medical system. With all the information I've presented today, I have only made a small dent into addressing the extensive and complex history of medical apartheid that has not only negatively affected the health outcomes of Black communities, but has also destroyed a large amount of trust between the Black community and the medical world. This lack of trust is a sentiment that does not go without merit. It is a sentiment that is completely valid and should be recognized by all. But this sentiment also makes me want to ask the question, how can we as Black individuals, as Black women, take back our own healthcare? How can we feel well-equipped to make informed decisions about factors that will impact our health? Well, we have to demand transparency. We have to stay informed by connecting with our physicians and other healthcare professionals and making sure that we're asking questions. We have to demand transparency in terms of what's going on behind the scenes in the medical world. We also have to make sure that we have the facts. Listening to facts are as important as listening to one's personal narratives in order to feel confident enough to make informed decisions about your own health. And there also needs to be intention. It is essential for healthcare professionals to be inclusive of the Black community when it comes to health communication. Health professionals have to be intentional with the relationships that they form in order to address the concerns of the Black community. However, I also want to make it clear that the responsibility should not fall on Black patients to advocate for these changes. It is incumbent upon those in the medical field to create an equitable system that cares for all and will allow Black patients to feel confident enough to serve as their own advocates and have their voices be heard. One effective way of bridging this gap is by having proper representation of Black individuals in healthcare. So a great example of this is the conversation that we're having today, and it's the platform that Dr. Daria Terrell has created at St. Bernard's Hospital. Therefore, I would love to invite to the stage Dr. Daria Terrell to help answer questions many people in the Black community have regarding COVID-19 and vaccine hesitancy. I also want to let our attendees and audience know that They should feel free to ask questions that they have in the chat as well, as we will also open the floor up for questions to be asked, and we will try to get through as many questions as possible. Okay, so Dr. Terrell, one question that we have has to do with your personal experiences as a Black doctor. As a Black doctor, why do you think it's important for our community to receive the COVID-19 vaccine?
Well, first, let me say good evening to everyone and say how happy I am to be a part of this conversation. And I think that it is very relevant and very necessary. And I will start answering your question by saying I, like a lot of people who are listening today, I had my own concerns just as a human being about the vaccine and whether it was safe and whether it was something that that I should do. But after trying to get as much information as I could, I made the decision that it was the best option for me. And I hope that's one of the things that people get out of the conversation today is just the information that they need to make the best decision for them. But to answer your question more directly, as a African American physician, I felt that it's important for me to have the information to give people about why they should take the vaccine if that was a question for them. One of the things that we saw early on during the pandemic was that people who had two or more medical conditions or what are called comorbidities had a higher risk of both contracting COVID-19. They had more serious complications and more serious courses of the disease, and actually were more likely to actually die from COVID-19. So when we put that data in the framework of the fact that we also know that unfortunately African Americans suffer from higher risk or incidences of medical conditions such as hypertension, diabetes, asthma, all of which also increased your chances of contracting COVID-19. I thought that it was worth recommending to people to consider the vaccine because ultimately the point of the vaccine is to decrease your risk of serious disease and to decrease your risk of death. And that is those are the two factors that were most severe in people with medical conditions. And by default, those are the things that we saw happening in our African American patients. So for those reasons, I think that it is very important for us to consider receiving the vaccine for all those who have not already made that decision.
Thank you so much for that answer. So going a little bit deeper into COVID-19, what did participant diversity in testing the COVID vaccine look like? What was the percentage of Black women in the vaccine trials?
Well, one of the things that I think is very important about the vaccine trials was that there was a significant amount of attention and effort placed in trying to make sure that there was representation in the participants. To the point that when the trials were actually taking place, at one point, they were actually stopped with Moderna because they did not have the percentage of African American participants that was reflective of the population. So to say that another way, if we know that African Americans make up about 13% of the population in the US, then we should have about that representation in the vaccine trials if we want to say that the data can be extrapolated or used to represent what happens in everyday life. The same thing also happened with the Pfizer trials. and both actually kind of paused the trials until they had enough people that they thought was representative. So in the trials, both Moderna and Pfizer ended up with about 10% of participation with African Americans. And I believe we do have a slide that kind of shows the breakdown of the trial participants by race. So the dark blue is the Caucasian or white participants, and then you see the dark blue is actually showing the whole U.S. population, and then as we go from left to right across the screen, you see the breakdown by race. So with the Black and African American participants, like for Pfizer and Moderna, they were both around 10%. Johnson and Johnson actually had slightly higher at 17%. But there was a great amount of effort placed in trying to make sure that there was representation. And the reason that this is important is if you are saying that a vaccine is safe, you want to be able to say that you've tested this across a population that represents all the people that you expect to take it, and all the people that you hope to take it, and all of the different variations, be it cultural or other social factors and other medical factors that might come into play with those different subpopulations. You want to make sure that we have equal representation in the testing.
Yes, I completely agree, especially with representation, something that needs to definitely be intentional when it comes to the medical world. Another question regarding COVID-19, specifically looking at Black women in pregnancy. Given that there is a high maternal mortality rate for Black women in America, should there be any extra precautions that Black pregnant women should consider when receiving the vaccine? If they do have any symptoms while pregnant, who do they report it to?
So I'm going to try to, I think those are all excellent questions, and I'm going to try to go one by one with these. So the first thing is that this topic is actually late breaking news. As many of you may have heard today, the CDC actually came out with an official recommendation stating that the COVID-19 vaccine is actually recommended for pregnant women and for those who are considering being pregnant. And I think this is very important because there's a lot of there are a lot of misconceptions. There are a lot of rumors that the vaccine causes infertility, that it's not safe for pregnant women. And I think now that the CDC has actually made an official statement, hopefully this will give people the confidence that the vaccine is safe. I think more interestingly is the data that goes with that recommendation. So and I think part of what has caused them to make this information more public is the number of women that have died recently after giving childbirth, or that have died while they were pregnant and did not get the vaccine. Right now, there are about 30% of Americans who are pregnant who are fully vaccinated. And sadly, the percentage of African American women that are vaccinated that are pregnant is almost 16%. I think it's about 15.6%. So we're still lagging behind in the percentage of African American pregnant women that have been vaccinated. The reason that it is beneficial to be vaccinated while pregnant, the pregnant people who have not been vaccinated have had an increase in the severity of their disease, to the point we see that they've required intensive care stays and intensive care treatment at 2 times the rate of those who are vaccinated. So, and also the death rate, unfortunately, is also higher in those who have not been vaccinated. I think one of the other really important things to also share is that unfortunately, we've been in this pandemic now long enough that we're accumulating more and more data. And one of the things that we know now is that there is some benefit to the infant that is received after pregnant moms have received the vaccine. So this was also been shown in recent studies, and it's now being reported that there is definitely been a proven benefit. So in other words, once a pregnant mom gets the COVID-19 vaccine, the antibodies that mom makes is then transferred to the infant. And so when a newborn infant is born, then the antibodies they receive from the mom actually gives them some initial protection against the SARS or COVID-19 when they are born. So I think that is another huge benefit, in addition to the fact that at the end of the day, we have to remember, and I'm going to keep saying it over and over and over again, the main intention of this vaccine is to prevent death. And as beautiful as the pregnancy and the miracle of life is, no one wants to see someone go through pregnancy only to have that mom not be able to see their beautiful baby live their life. So as much as we want to protect our moms, we're also seeing that this helps make sure that our moms actually survive the delivery and are there to take care of their babies, and also are also protecting their babies by transferring those antibodies that they receive in the vaccine. Everyone who gets the vaccine is given a link and information to put their data into a data bank system that is then administered by both or all of the vaccine companies. And they do send text messages asking your symptoms. They actually ask if you've become pregnant since you received the vaccine. And in the early days, that was a way of tracking the effect of the vaccine, if you will, or if there was an effect of the vaccine on the ability to get pregnant. Even though people who were pregnant were excluded from the trials, there were about 3,000 people who were tracked after the initial vaccines who got their vaccine and then became pregnant. And that data helped us to see that the vaccine did not, in fact, cause anyone to be infertile. It did not prevent people from being pregnant because there was actually, real life accounts of people who had received the vaccine and then become pregnant. As after someone had their vaccine and they've signed up for the tracking system, then if any symptoms that you would have that are relative to the vaccine, you would report through that system. And then you are then also, you're followed by both the manufacturers, and that data is also a part of the data that's collected by the CDC. Obviously, any symptoms or anything that occurs after the vaccine that is worrisome should be reported to your physician, and then you would follow the immediate directives of your physician. But there is a very close and accurate monitoring system that does occur with the vaccine.
Thank you so much for that elaborate answer. There's a lot of details that I think are very necessary that some people may not have had. So I really appreciate that. There's a question here from someone in our audience. The question is, what are the health conditions that are not allowed to take the vaccine? So I guess, what are some health conditions that would prevent you from being able to get the vaccine?
So that is an excellent question. So the official answer to that question as of 7:03 p.m. Central Standard Time on September 30th, 2021 is that the only people who are not able to have a vaccine are individuals under the age of 12 and anyone who has had a severe medical reaction to the first COVID vaccine. So, and that those recommendations are based on, again, all of the accumulated data that we've gotten to this point. So there have been enough people who have had the vaccine that we've been able to eliminate a lot of the populations or diseases that I think were a concern initially. So for example, we weren't sure about pregnant women. Now we know that it's safe. There were specific conditions, certain people with cancers, certain people with very, very severe respiratory conditions, who we just did not have enough data to know whether the vaccine was safe for them. But now we have had enough people, and again, that's where this tracking system comes in. So after you have your vaccine, you get a text the day after, the week after, and it goes on, and it does allow you to report any symptoms that you have, and that's one of the main ways that we're able to track the side effects, if you will, of the vaccine. And through that, and through the time, we've come down to the vaccine is safe for everyone except those two under 12, which, as you all know, is still something that's evolving, and that may change in the next month or two, and those who've had a severe reaction.
Thank you. There are some questions in the chat dealing with booster shots and when you get your second dose, and talking about like which company you should use. So if you receive Johnson & Johnson on your first dose, or Moderna or Pfizer on your first dose, should you get a different vaccination, or should you stick with the same one that you received on your first dose?
So I'm going to try to be as clear as possible. Right now, the recommendation would be that once there is a official recommendation for a booster vaccine for whatever category or circumstance you might fit into, you would get that booster shot that it was distributed by the same company of your previous vaccine. So if you had a Pfizer vaccine and you fit under the categories for booster right now, you would get a Pfizer vaccine. If we're anticipating that Moderna will also have a booster, then you would get your booster from Moderna and J&J as well. The thought is right now, we just don't have enough information to know whether it is safe to cross the vaccines. So because of that, the official recommendation is to get the booster and it be the same that you got for the initial vaccines.
And on the topic of booster shots, can you explain why booster shots are actually needed, who should get them, and you answered whether or not we should mix two different vaccines.
So one of the issues with vaccines is how long the protection that we want from the vaccine actually lasts. And so part of that is based on the antibodies that our bodies build up as a result of the vaccine. So without going into all the details of the vaccine, what we want them to do is help our bodies make antibodies which help fight the disease. And the reason that we need the booster shots right now is because over time, we're seeing that the amount of antibodies that our bodies are producing can actually decrease. One of the reasons that the people who are immunocompromised were the first ones who were recommended to have a booster is because we think that people who are immunocompromised don't produce enough antibodies, or the the antibodies that they produce are not at the same level as someone who's not compromised. And so therefore their protection, if you will, does not last quite as long. So the same, which is also what happens with the elderly. So that is why the recommendations right now are for boosters, and the Pfizer vaccine is the only one that's been approved so far for a booster, and that is for people who are immunocompromised, those over age 65, and they're and it gets a little confusing because initially the CDC advisory committee said other special populations didn't need it, and then the CDC then did go and officially say that people who work in certain close conditions, so for example, people who might work in a group home, people who work in senior facilities or skilled nursing facilities, and now it's also been extended to healthcare workers. So all of those are eligible for boosters.
And so what about the individuals who receive Moderna or Johnson & Johnson vaccine? Should they expect a booster shot to be available soon?
So both Moderna and Johnson have been working on their booster shots in the same time course with Pfizer. And yes, I think you should expect that booster shots will be available for both Moderna and Johnson. There is a process, that's involved, and that whole process is all designed to make sure everything's done safely and done in the most effective way possible. And so with that, Moderna has to actually apply for authorization, and that is if they're very close to that point. One of the interesting things is that with the work that they've done on the Johnson & Johnson booster, they're actually recommending that when it is approved and officially, authorized, that anyone who had the J&J vaccine would be eligible after 2 months. So the Moderna and Pfizer are pretty close to 6 months in terms of the recommendation for when you should get a booster. But there is a distinction with Johnson & Johnson that the time frame would be 2 months once it is actually approved and authorized for boosters for Johnson & Johnson. And the efficacy or the effectiveness of the Johnson & Johnson vaccine is thought to be about 77%, I think, was the more recent data. And the thought is with that booster from Johnson & Johnson vaccine, it would bring the effectiveness or the ability to keep you from getting serious disease closer to 94%, which would make it closer to the data for Moderna and Pfizer.
There's another question in the chat that is referencing antibodies. If I had COVID-19 and my test results show that I have very high antibodies, is it safe for me to get the vaccine?
So yes, you can get the vaccine. I think a lot of our recommendations have changed, and they evolve as we know more things. So initially, if you had COVID-19 and had antibodies, the recommendation was you could wait at least 3 months before you tried to get a vaccine. And I think some of that was logistical because we wanted to make sure that we had enough vaccines for elderly, for healthcare workers, when the vaccines were just rolled out. So in theory, if you had sort of natural protection that was granted by your body making these antibodies, then you didn't need to have the protection that's given by the vaccine. Now, basically, anyone who has completed the initial 2 doses And as long as you're not, and if you had tested positive, as long as you're outside of your quarantine period, which averages about 10 days, then you can get the booster.
Thank you. I have a question here that deals with the Johnson & Johnson vaccine. Earlier, you had mentioned that it was only, I think, around 77% effective the first dose. But in addition to that as well, several of us know that some Johnson & Johnson products, such as their baby powder and their OGX shampoos, have found to be unsafe, and these are products that are often commonly used in the Black community. So given this, do you think that it's still safe for individuals to take the Johnson & Johnson vaccine?
I think my answer goes back to something we've heard a lot over the last several months. We have to look at the science and we have to look at the data. And if you look at that, the studies and the way that the process has been developed, we are supposed to be able to have some confidence that because the Johnson & Johnson vaccine was actually released, that it had gone through all the necessary studies and protocols that demonstrated that it is safe. So that's my starting point with the Johnson & Johnson vaccine. There it is, I think the most recent study looked at the 3 vaccines from March to September and looked at how effective they were again at preventing serious illness and death. And so I think that period, March to September, Johnson & Johnson was 71%. I think Moderna was 94%. And I believe Pfizer was about 88 or 89%. So not far. And that, again, that was just March to September of 2021. What that means is that in 71% of people, that received the Johnson & Johnson vaccine, that vaccine kept them from having serious illness where they had to be hospitalized on a ventilator and kept them from dying. There have been obviously anecdotal reports that we've all heard in the news, but what we do know is that the Johnson & Johnson vaccine was put through the same testing protocols. It was held to the same measure and was then deemed to be safe and effective. The numbers speak to themselves. I think the only other difference with the Johnson & Johnson vaccine that has been actually published, and I would say if someone was thinking about whether the Johnson & Johnson vaccine was the right vaccine for them, if someone had had a history of Guillain-Barré syndrome, which is basically a disease of the nerves, there was an actual statement put out by the FDA that there was a slight increased risk of the development of Guillain-Barré with the Johnson & Johnson vaccine. So that would be, if I were to tell someone, how do I figure out which vaccine is the best for me? If that's a concern for you, then maybe that might change your opinion about that particular vaccine. But otherwise, there's nothing to suggest that the J&J vaccine is not as safe.
Thank you. I have another question here in the chat. Why do you think so many people are reluctant to get vaccinated? Some patients are having their healthcare providers tell them that they shouldn't get vaccinated.
I don't know why there are so many differing opinions. Okay. I think the most important thing for all of us is to get as much information as we can from credible sources. And I think there has been so much hesitancy around this vaccine because there's been so much information that's exchanged, and I would argue not from credible sources. So when people are having, very informal chats on Facebook or Instagram, and those conversations are not based on science, I think that has led to a lot of anxiety and a lot of the hesitancy. Now, again, as you pointed out, there are some real historical and factual valid reasons for people to question. And there's nothing wrong with questioning. I think the next step after questioning then is to get, again, credible information, talk to credible sources, and then draw your own conclusions. Because my aunt said so, or because my uncle said so, or because the neighbor down the street said so, may not be the answer that's in your best interest. But I think, what started in historical concern has just kind of gotten away from us, quite frankly. And the rumors and the misinformation, unfortunately, is fueling a lot of this. Like the whole infertility argument is a good example. There's absolutely no data whatsoever that says the vaccine makes you infertile. Again, like I said, it was sort of accidental that they had 3,000 plus people after they first initiated the vaccine who became pregnant, after being vaccinated. So to me, like if that doesn't say, hey, this doesn't make you infertile, but yet that still exists. The American College of Obstetricians and Gynecologists say it's safe for pregnant women, but we still have people saying it'll make you infertile. So.
Yes, and as we touched upon earlier, making sure that we have the facts in addition to listening to personal narratives is really important in order to make sure we're making the best informed decision about our health. But speaking about people who are just misinformed, how do we make sure that they get the right science facts about the vaccine? How do we make sure, where do they go to in order to receive the best knowledge?
I think that's an excellent question. Credible sources, when we say that, is relative. Obviously, when our larger medical bodies like the Center for Disease Control, that we look to give us guidance about medicine, and then the FDA or the Food and Drug Administration that we look to set parameters for safety, those are sort of the gold standards. I think it does become confusing because, as you pointed out, there are healthcare professionals who have probably, spoke with just as much conviction as I'm trying to have today and tell people don't get the vaccine. So I think it's looking at sources that you trust. I think it's taking the extra time to find what are the bodies that most people trust, or what are the bodies that we're supposed to trust? What information do they give us? And I think at some point we just have to kind of use a little common sense too. When you have so many people who have died from one entity, literally killed millions of people across a globe. One entity has now shortened the life expectancy of African Americans. So when I say that, the life expectancy of an African American is now 3 years shorter because of COVID. So when I look at big picture things like that, those were the reasons that I chose to be vaccinated, because I had the same concerns. Was this done too quickly? How do I know I'm not gonna, grow an 11th toe? How do I know I'm not going to turn green? And it was just in talking to people, reading, that I found some comfort level. And I'm still here, only 10 fingers, 10 toes, and I don't think I'm green.
Thank you for that. And thank you for being vulnerable and sharing your reasoning for getting vaccinated. I have another question here in the chat. Can someone who has completed the quarantine period but still have symptoms get the vaccine?
Yes. So as long as you are, as long as you're not still in your quarantine period, technically you can receive the vaccine. Now, I will qualify that a little bit and say, depending on what your symptoms are, you should take into account the fact that some people do have some side effects or, some ill feelings following the vaccine. So you have to take into consideration what symptoms you have that are still remaining from COVID and whether you want those potentially amplified. So we know that people might experience some arm pain after the vaccine. Some people feel a lot of fatigue. Some people feel like they do have a mild case of the flu or just feel really ill for about 24 to 48 hours following the vaccine. So I would just say that if you are considering the vaccine and you still have symptoms, just keep that in mind. Some people have those symptoms and others don't, but just make sure that you're considering that in context when you think about getting a vaccine.
Thank you so much, Dr. Terrell, for taking the time to answer all of these questions. I have one last question before we do have to wrap up, because I do want to be respectful of everyone's time. This person said that they have heard people express concern about the lack of long-term safety data on the COVID vaccines. What do you tell people who express these concerns?
So I will tell you what I told myself, because I was one of those people. And that was one of the ideas I had to get past. As a physician, I like to recommend things to people that have a track record. So I want to know the data 5 years, 10 years, before I recommend something to someone. And at some point I had to realize I just was not going to have that, because this was evolving, because this was new, because it was happening so fast, and because the effects were so enormous that I had to put faith in what we know here and now. And I had to come to grips with the fact that, we just are not going to have long-term data right now. And the other part of that is, did I want to accept the consequences if we did nothing and waited? And with the numbers of people who were dying, and if you've talked to anybody who had really severe symptoms from COVID, they will tell you that is nothing that you want to experience. And so I had to make a decision to go with the science and say, this has been shown to be effective, as effective as we know, and have faith in that. The other way that I looked at it too is that there are other vaccines. We get the flu shot every year, and they might change that, and there's little nuances, and we don't look at the long-term track record of the strain of the flu vaccine that we get from year to year. We just go and get it. So I think that was also part of how I looked at it. And I'm using me as an example because that was one of my main concerns is, and obviously as time goes on, we will have more data.
Okay, well, thank you again so much. Really appreciate you being here. If everyone on this webinar could give a little virtual clap for Dr. Terrell. This conversation is something that is very important, and for you to take the time out of your day to speak with us and just continue to be a part of our community to help uplift us is something that it really is impactful on me especially, and I think can be very inspirational to other people in the community as well. Before we sign off, I want to let the audience know that we do have a poll that we would like to administer, and we want you guys to answer based off of, after listening to this webinar, what are your answers? So I'll give about 1 to 2 minutes for you guys to answer that before we officially close out. And while people are completing the poll, I want to make sure to thank AMHP again, American Muslim Health Professionals, for hosting this webinar and for inviting me to be a part of this. I also want to give a really big shout out to Yamin and Aruna, who have been in the background working with me to be a part of this webinar, and of course to Dr. Daria Terrell again. Please, if Dr. Terrell or Yamin or Aruda have any final closing remarks, please feel free to share.
I just would like to thank everyone and also applaud everyone who joined, because this is taking a big step in just getting information and being willing to listen and have a conversation, if you will, about this. So many people just kind of make decisions without having information or being willing to listen to the other side. So I thank everyone for being a part of this, and certainly help and certainly thank everyone for allowing me to be a part of this discussion.
With that, we can go ahead and close out. Once again, thank you guys so much for taking the time out of your day to be a part of this discussion. As Dr. Terrell said, I hope you guys have a wonderful night. And please continue to stay up to date with AMHP for other conversations and events that they will be hosting as well.